know that urban teens are getting STIs at the fastest rates in the country? 1 in 4 female teens in Boston has an STI, and nearly half of African American girls has a sexually transmitted infection. Teen pregnancy is on the rise for the first time in 12 years. Nearly half of 15 to 19-year-olds in the United States has had sex at least once. Why is this issue impacting low-income youth of color more than other youth? Tonight, we take an in-depth look at sexuality education in Boston and how African American and Latino teens are disproportionately affected with higher STIs and pregnancy rates. We interview teens, parents, and the experts to dispel the myths that parents do not want sex ed in schools and that sex ed just promotes more sexual activity. Joining us tonight is Dr. Prelude from the Center for Sexual Forecast to give us a prediction of what we're expecting for summer of 2010. Welcome to the show, Dr. Prelude.
Thank you. Glad to be here.
So, Dr. Prelude, what are we looking at for summer of 2010?
Not good at all. With all the youth out of school for the summer and the historical low numbers of jobs available to them, we are predicting a hot summer.
What do you mean by hot, Dr. Prelude?
I mean very high rates of STIs and even a spike in teen pregnancy rates, that kind of high. I mean, I'm not surprised. No one's talking to these teens about how to protect themselves. What do we expect?
That's disturbing, Dr. Prelude. Is there anything else we should be looking out for?
If the communities get involved, things might change. But for now, it is not good.
Despite the alarming rates of pregnancies and STIs, there is still no standardized sex ed in Boston public schools. Our reporter in the field, Michelle, visited some area high schools to find out just how much our youth know about sexuality. Michelle?
Thank you, Marilyn. Here we are at an actual Boston public school with actual students, 56% of whom will have sex before graduation. Here's one now.
Yes, I have had sex ed, but it was like 6th grade though, so it hasn't been recent. Like I don't have sex ed classes in high school now, so.
I've had sex ed my sophomore year in high school. It was just like a one-time thing. It was just like a 10-minute experience.
In 8th grade for health class.
That was like the only time it was like 30 minutes, part of gym class.
I have received sexual education learning in school, but it was like in like an auditorium, and they just said to us, oh, sex, STDs, don't have sex, you're gonna have sex, use a condom.
And then it was kind of nasty at times because we were in 8th grade and we didn't really know that kind of stuff. But it was good to know about our body parts and what they can do.
I do not think my gym teacher was qualified to teach the sex ed class.
That was like assembly, it was like 30 minutes. That was it.
It was around 6th grade, and it was about like an hour.
I think if some health classes taught you some things your doctor would teach you, then there will be less children. There will be less males and females walking around with sexually transmitted diseases.
We've asked students where they get the information about sex. One common answer has emerged.
Porn, magazines.
TV, I'm flicking through the channels, blah, blah, blah. I just seen it.
Porno?
There was like a bunch of like pornos on TV.
Porno.
Before we continue, one quick word from our sponsor.
Empty house, empty house.
Yeah. What are we about to do?
I don't know. What do you want to do?
I mean, it's whatever.
Let's go, Sam. What's it?
Chlamydia.
It's gonna be a joke.
Ew. Marilyn, Ivan, we need to talk. I'm a busy woman. I have no time for this. JP has one of the highest rates of chlamydia in the city. I talked to you guys last week. I've been to 10 crotches tonight, and I don't need any more of this. I know you guys had a fun time at the movies. I was there. To avoid another one of these embarrassing moments, please use a condom when having vaginal, anal, oral sex. Here's a condom. Use it.
Now let's hear from some medical doctors. We have Ivan at Southern Jamaica Plain Health Center. Ivan?
Thanks, Marilyn. I'm here at Southern Jamaica Plain Health Center where we're going to be interviewing some actual doctors like Dr. James BASTIAN, who's been a pediatrician for 12 years. Let's go inside, shall we?
My opinion as a pediatrician is that it's extremely valuable and necessary for students at almost all ages to receive education about health and sexual health, of course tailored to their developmental age.
What else before you open it?
Don't you have to check the expiration date?
I believe that the topics that should be included in the curriculum for adolescents and sexual health should certainly include the basics of naming the body parts, explaining what the body parts are about, the reproductive organs, talking about reproductive health and the responsibilities of that, so including sexually transmitted diseases, undesirable pregnancy, contraception certainly, including abstinence and the option to not actually engage in sexual activity.
So it's a shot that you take every 3 months.
We also want to hear from a medical professional who works at a city level. We spoke with Nancy Norman, the medical director for the Boston Public Health Commission.
We do not disagree with a plan that has a comprehensive health education program available to all public school students. And I think you would find that our commissioner, the head of the Boston Public Health Commission, agrees with that, as does Superintendent Johnson of Boston Public Schools, as is the mayor of the city of Boston.
Although there are some scattered examples of comprehensive sex education taking place in Boston Public High Schools, for the most part, the minimal sex education classes are being taught by physical education teachers who have little to none training on comprehensive sex education.
So the question is it true that the less teens know about something, the less likely they are to try it? To find out, we interviewed Barbara Husher Cohen, the only person in the entire BPS school system, K through 12, who is paid to oversee all sexuality education in the Boston Public School system. Let's take a look at that interview.
In my opinion, sexuality education should be taught not only to teenagers, but to all children.
It's up to the person having sex using the information they get. I think it's fair to just give sex ed. It's up to the people if they want to get pregnant or not, you know, if you're going to use it or not. That's what it is.
It's up to you if you want to have sex or not, but wouldn't you rather be safe about it than not be safe about it at all?
My friend, she hits me up and she tells me, oh, the guy cummed on her. And I'm like, where did he come on you? And she was like on her chest. And then I was like, and then she was like, can I get pregnant from that? I'm like, no, you can't.
When I hear like my friends are having sex, I'm actually shocked that I hear that my friends are using condoms, because the education I grew up, I kind of half expect like my friends when they're having sex that I actually expect them that they're not using them. Like I would hope that they're using them, but I actually like when they start talking about sex, I don't even think of the fact that they're using condoms. I immediately think in my head that they're probably not even protecting themselves.
If we had more sexual education courses, I think that it would actually lessen the fact people actually have sex. A lot of friends of mine got pregnant. One of my friends had a STD, so it was like, it's really hard because like you didn't learn anything, so you can't tell them like this is what happened. Like you can say it's go to the hospital because you don't know how to help them at that point in time.
I do know a lot of young people who have gotten pregnant, have STDs and things like that at a young age.
Yes, all my friends are pregnant. I have like 7 that are pregnant.
Even very young children can learn proper names for parts of their bodies. I think they should have their questions, if they have any, answered about their health and about sexual health.
Conversations around sexuality, sexual identity, good touch and bad touch, communication in intimate relationships, talks about what intimacy is, what loving is, what liking is, should start early. I'm having those conversations with my 4-year-old now.
Although the rate of sexual activity amongst teens in the U.S. is the same as that of Europe, U.S. teen pregnancy rates are twice that of England and 4 times that of France. Why are U.S. teens having so many babies?
If you look to Norway and the Netherlands, they have such wonderful sexuality programs because they address sexuality as the way we were created. We were all created to be sexual human beings. We were created to have sexual feelings toward another person. That's what makes us different.
You denied me the right to be loved unselfishly. Packed to my heart, turn away from your pain. I said it once, but I mean it this time. Time, I'm gone away. You'll never see me my face again, except for in your dreams. When you think of the love you turned away from me. Time, I'm gonna wait. Now that you're gone, my life is not so